Thank you, Vanetta. It is so great to be here with all of you today. I want to start with a quote, or actually I'm going to paraphrase a quote that I think all of you can relate to and probably know of. People will forget things that you said. They'll forget things that you did, but they'll never forget how you made them feel. To experience that is to know Pete Domoto. And I'm looking around the room and seeing so many heads nodding and shaking because, yes, we all know that those were feelings that Pete instilled in all of us. He cared about all of us. He cared about community. A part of my personal history that I'll share is that when the University of Washington was recruiting me many years ago to be a member of the faculty, this person showed up on my agenda or my itinerary that I had no idea who he was. And he was going to take me to dinner. And the place he was going to take me to dinner was at a meeting of the Washington State Association of Black Professionals in Healthcare. Now, if any of you know the University of Washington, there are not a lot of people that have my melanin makeup, and especially in a dental school. And Pete knew that it was going to be important for me. If I'm going to move from Pennsylvania to the state of Washington, I need to find my community. Pete was a friend of that community. Pete was a friend and a member of every community, just blended in so seamlessly. So I made a decision. I come to the University of Washington, and I get to learn way more about Pete. And as I learn about Pete, I learn of his caring demeanor, not only for students and communities, but for everyone, and really being a champion of oral health. And with that time, I think we can see, I can see, and I know that all of you can see, the mark that he's left. For example, Eve and I were talking earlier today about an early experience she had that was pivotal in her deciding that treating small children was something she wanted in her practice. Pete was a real champion of that, doing it through service learning rotations. We didn't call it that back then. It was putting students in community to learn care. And I really emphasize learn from community, not come in a paternal sort of way, learning from community how to do that. Now, granted, for lots of dental students, this was an adventure to make lots of enamel dust and feel like a dentist, but they were actually learning community need and how to do that work very, very importantly. The University of Washington School of Dentistry has grown that program. It was a hidden sort of program that no one knew about. Well, you knew about it in pediatric dentistry, but it was really under the radar. This is early in those days of community-based learning, service learning, something that is a very important part of what the university is today. In fact, you've probably heard of our regional initiative in dental education, which has taken that early work of being community-based and blown it up into being really, truly regional. Many of our service learning rotations also do that same sort of thing. In our curriculum, learning how to work with underserved communities, ranging from starting how to learn how to work with interpreters, very important skills that help people, families, know that they belong and that they're important. That's a value that Pete instilled in dental students, and it lives on today. So I think what I'm painting here is a picture that Pete lives on amongst us, and his good work will continue. I consider myself incredibly blessed to have gotten to know him even more, and in doing that, learning where that incredible value comes from. Remember, Pete was the first and the founding dental director at Odessa Brown Children's Clinic. And to know that their motto is quality care through dignity, that's Pete Domoto. And to pass that along in a very quiet, unassuming way is Pete Domoto. Sylvia, his wife, is here with us, as well as his daughter Laura. These are your people. We are all champions of Pete, and we are so thankful and grateful for you sharing him with us. And in that quiet, unassuming way, know that what he passed on to us, we continue to give forward, and we are so grateful for the gifts that Peter has given to us and that you shared him with us. So I think many of us have a lot to be thankful for. I know that the oral health of small children across our state, especially those who live at the margins, are especially appreciative of Pete's work, and we're going to make sure this keeps going and just gets better. And now I'm going to turn it over to Scott Kennedy, who's going to, I think I've heard there are some recognition things and stuff that's going to happen. So Scott,